Imi, thanks very much for joining us at what I can only imagine is an incredibly busy time for you. Aside from being the head of medical services at QPR, you're also, of course, a GP as well.
Yeah, it's been a difficult time for lots of people, but I think it's important to kind of step up at these times and try to kind of get the right messages across. So no, it's been challenging, but also rewarding.
We've asked staff for any common questions, fears, concerns they have regarding COVID-19, coronavirus. Firstly, we'll just work our way through them in the order that they were received. What advice would you give about visiting elderly relatives, maybe in an open space and keeping at a distance? Is that practical?
Okay, so this question is about social distancing, really. You would have heard the advice in the last few days about social distancing, which would mean that we try to kind of stay away from people who are certainly in vulnerable groups, and try to kind of stay away from large mass gatherings, stay away from small gatherings in public places. Now that's extended really to those patients with vulnerable in the vulnerable groups who are like the elderly above 70 and those with any kind of comorbidities. The kind of comorbidities that people are talking about are if you've got any chronic lung problems, any chronic heart problems, kidney or liver problems, diabetes, and if they're on immunosuppressants. So with that kind of category of elderly relative, it's quite straightforward. You should try to stay away, especially if you're working outside in a general population, and then you bring something in towards them, because they could be at risk. Because as our current thoughts are, and what we're currently seeing for this COVID-19 outbreak, both in China and also in Europe, is that it does affect the older people with comorbidities more. Now, on a real practical basis, then we're all asking ourselves these questions. So, do we actually go and see our own relatives? And I think that is the advice currently is not to, and to try to kind of distance away if you can. Now, that's not always practical in all cases. So, if you do have to visit, the next bit of advice is to try to stay away at least 2 meters apart. If we all see what actually is happening around with the outbreak and see the effect of it, and understand the effect of it, then it makes it a bit easier to understand why we would then follow such stringent advice, because I know it does impact on many people in their lifestyles.
Okay, my parents are in their early 70s and in good health. Can they visit us? We visit them. We have young children.
Okay, so it's quite similar to before. Young children won't be affected seriously by this condition. Okay, so that's something to kind of bear in mind. So they will, though, be passing on to each other and to young adults who, again, won't be affected in the majority of cases by this. They'll only get usually mild symptoms of the runny nose, cough, fever, that kind of variety. However, if they then pass it on to the elderly and they then get it, they might get much more severe symptoms. So if you wanted to protect them or protect the elderly from being exposed to it, then the advice is to try to stay away, to kind of be in contact in different ways, whether it's on the phone or on social media or text or any other way, rather than need direct face-to-face contact. Because as we all know, in reality, especially with children, when children are with grandparents, they'll be jumping on them and being on top of them, which actually does make it quite hard. Now, with the closure of schools, that will make it easier. So if children then stay well and they're off school and they've kind of been isolated from other children, then at another stage that it might be actually okay to start visiting as long as there's a distance. But I think that is a personal call. We have to currently follow what the guidelines say, and they say to try and social distance as much as possible.
Is it okay to visit friends at the moment?
Yeah, so well friends. So if you were to contact friends who are well, you can visit those. You can just check to make sure they haven't got a fever and they haven't got a cough. So the advice is against big groups. They haven't given a number. In some countries they've said groups of 10. In some other places groups of 5 is what they've mentioned. So if it's a friend that you wanted to visit and you stay 2 meters apart, then that will be okay as long as they're well. And I think it's important actually during this time when we're starting talking about things like social distancing and self-isolation. They're not nice words and words that we thought that we'd ever have to talk about. So therefore it's important that we actually still maintain contact with our friends, but to do it in a really sensible way, especially in the middle of this outbreak.
What should I do if someone I live with starts exhibiting symptoms?
Okay, so that's pretty clear. So if they exhibit symptoms of a cough, a fever, a temperature, shortness of breath, and they're well, so if they're kind of mild symptoms, then they should stay at home and self-isolate, and they themselves should stay isolate for 7 days. If you're a household member and you're living with them, then actually you need to self-isolate for 14 days, because at any period in those 7 days you can pick up the same infection from them, and then it could last another 7 days. So those cases are going to be quite a high impact, because potentially you'd have to be at home for 14 days.
Is there any benefit to wearing a face mask in public?
It's a good question. I get asked that quite a lot. Current guidelines evidence show there's only benefit if you're symptomatic. So if you have those symptoms of coughing and sneezing and fever, and you're going out, of course, if you've got those symptoms, you should be at home self-isolating. And then the only other group who have benefit from wearing a mask is medics who are actually doing the testing, so doing the swab or nasal or mouth testing for coronavirus. So they're the only two groups. So no is the answer in terms of the general advice for that at present.
I like to be outdoors. How safe is it to visit my local golf course where I may come into contact with fellow members?
Okay, so going outdoors is fine if you're on your own. Okay, so remember that the transmission from this, as we currently understand, is not through the air, it's through droplets. So it's through touching other people who've got infections or been affected, or if they've then touched or sneezed onto their hands, then touched the door handle or touched anything outside, and then it's onto your hands, and then you then wipe your hands onto your nose, mouth, or eyes. Going to a golf course and actually playing, most of it is going to be solitary. However, there's a lot of there's quite a big community aspect and social aspect for that. So it can't be advised in terms of meeting other people and socialising and being in a bar or a club type area. So going outside, doing advice, doing solitary sports, maybe meeting with another friend is fine, as long as you're staying fairly away from each other. But you'd have to check that whoever you're playing with hasn't got a fever and cough, and make sure the groups aren't too big.
I see the National Trust parks are offering free entry. Is it safe to visit these?
Yeah, I heard about that. They are free entry, but they're also within the parks closing their cafeterias and restaurants. And so I think they're stipulating that if you wanted to go yourself or with your family for a walk, if you're in that close group, then it's open for them. But it's not for any kind of mass groups or sitting down and having coffee and tea together.
My niece is 15 months and was told she had COVID-19. Her parents were told she should stay at home and see it out. Is there any other advice you would offer for young children displaying symptoms?
So I hope she gets better soon. In terms of COVID-19, as we've said, in young people it's normally mild. So if it's mild, then the general advice would be to stay at home. So I imagine they would have got advice either from 111 or from their GP via telephone. They would have displayed some of the symptoms, and that's correct advice to stay at home. There's nothing else to do apart from making sure they're well hydrated and using paracetamol if they have a temperature. Currently only paracetamol is recommended, not ibuprofen, but that should be enough to make sure the temperature stays below 38. And in terms of anything else, it's no letting the body fight it off. There's no medication or any antiviral medication to fight it off. But the thing to do is to make sure they haven't got any signs of deterioration or worsening, such as a worsening persistently high fever, if they become short of breath, if they start having difficulty breathing and they're using their airway muscle or their chest muscles a lot more, or they're grunting, if they've got signs of dehydration, like they're getting more tired or lethargic, having a reduced urinary output. So just to check if they're drinking enough, and if they're not, making sure they're having wet nappies. They're the kind of general things that most people should know about in normal viral illnesses, and it'll be the same for your niece. Just making sure that she kind of is able to have all the measures to help fight off the infection, which in the majority of cases she will do.
Okay, and this next question, I've heard this one quite a lot from a few different people. Am I missing something? COVID-19 is very dangerous for people in their 80s, with a mortality rate of approximately 15% for that age group. So still an 85% chance of survival for the very elderly. Are these measures that are currently being put in place a bit extreme?
Okay, that's a really, really good question, because that's the kind of question, if you understand it and get the answer for it, it'll start making us change our behaviour. So you're right, in most younger people it's mild, and actually even in most older people they should be able to get through it. The problem is the numbers are so big that the percentage of people who are getting severely unwell from it are big as well. When the percentage of people who are getting severely unwell increase, or the numbers increase, they'll end up going to hospital, and already the hospitals are clogging up as a result of COVID-19. So to give you an idea, at our local hospital, at Guy's Hospital, there are normally 50 critical care beds, normally 60 critical care beds to be used, and currently 50 of them are already occupied. And as the virus continues and spreads, it's likely that more people will require those critical care beds. Now, if we have an attitude that actually, look, it's all right, it'll be mild, then more of those at-risk people, the vulnerable, the above 70s, those with chronic conditions, will get affected, and a proportion will end up going to hospital. And if they end up going to hospital and there's no beds for them, or there's no facility to actually provide that treatment, that will cause knock-on effects for all of us. It's important to understand that the effect won't be just for those people in their beds. The effect will be around the whole hospital. So they'll have to start creating more beds. So routine operations will have to start being cancelled. Once they start being cancelled, A&E departments will have to be used for other things. And at the moment, it's not a good time to go to hospital. Everyone is just focused on COVID-19. So if you have your standard accident, playing football in a park, or a car accident, it's not the right time, or not a good time to go to hospital, because there'll be less resources for that. And that's why you can see the strong messages coming from the medics that we have to socially distance, we have to self-isolate if there are cases, and the social distancing is the big deal. So it probably does relate to this question, that actually the social distancing, it will affect our lifestyle, and yes, it is a big deal at the moment, even though it's mild in the majority of young people, and a lot of the older people will recover, simply for that reason, that those who don't will clog up the system.
Okay, why is it so difficult to put a timescale on when things will return to normal?
Okay, that's a good question. It's because the outbreak is happening live. It's actually happening and the pandemic is happening as we speak. You can see the numbers are now slowing down. The daily numbers are slowing down in China. So if you're looking kind of as a curve, it's coming down over there. The issue though is that curve is rising still in Europe. And so that's why it's difficult to put a number, because if it starts rising and it starts curving down, then that's great, and that will eventually happen. But we're in a stage where it's still rising, and that's why there's a lot of stories coming out from Italy and now Spain, and we're now following that in the UK. So we're about 2 weeks behind what's happening over there. If the impact is similar to what's happened over there, then it'll be significant. So that's why it's hard to put a time frame. It's hard to put a time frame on it. And yesterday, the government put a 12-week time frame tentatively on it, and we'll see how that progresses.
That 12-week time frame, is that 12 weeks to the peak or 12 weeks to the end of the downslope?
I think it's towards the end of the downslope.
Okay, and why is it the elderly and pregnant women are most vulnerable?
Okay, so the elderly is quite easy to answer because they have other comorbidities or other pre-existing medical conditions, which makes their immune system reduced, and so more susceptible to picking up infections, but also more susceptible to picking up worse varieties of that infection, or that the infection affects them more seriously. So elderly people have more chronic lung disease, more chronic heart disease. They're more likely to have had chronic kidney disease or liver problems. They're more likely to have had diabetes. They're more likely to be on a medication that could reduce parts of their immune system. And that message is pretty clear in terms of the elderly being affected more, whether it was in China and the Far East, or whether it's in the case that we've seen in Europe, it is affecting the elderly more. The second part of the question was about pregnant ladies, and it's not affecting young people. It's not affecting currently pregnant ladies any more than the general population. That's what the current guidelines or evidence is showing. However, pregnant ladies are always a special group. There is a special categorized group because we've not seen the evidence is still developing, so we don't know the impact, and it's always worth being more cautious with that group than others. So I'd support that, although it does make it difficult for that group in particular.
Okay, and what's your final message for people who are naturally concerned during these unprecedented times? Give us some hope for optimism.
Yeah, I would be optimistic that it will come to an end at some stage. I think in order for that to happen, we will have to understand it first, and even if we don't want to, because sometimes it's best just to turn the TV off and not know what's going on and carry on our daily lives, but just accept hopefully for a short while that it will affect us. It will affect us maybe significantly in some cases in terms of that social distancing, but we will get through it, and especially the young people will get through it. But I just think that actually most of the measures we're doing, although they might be tricky for us and even more tricky for others and really difficult in some cases, we're doing it just to protect those vulnerable groups in particular. And once we get through that phase, and hopefully that will happen over the next few weeks and maybe up to 3 months, we'll then get through this and look back and say, actually, we took all the right measures at the right time.